Good morning. So let's continue with the basic organization of our nervous system. So I remember we did up to the neuroglia of the nervous system. So we were to start with the central nervous system. So we'll just have an overview of the same. Uh, so when you talk of the central nervous system, we said that this is in much respect to the brain and the spinal cord. The first structure that maybe we'll explore is the meninges, because meninges is the covering layers of both the brain and the spinal cord. It is good to understand how the meninges are arranged, because from the meninges, of course, in close association to the brain ventricles, we'll be able to understand how the cerebrospinal fluid normally flows, because it is good or rather important for us to understand that circuits from where the cerebral spinal fluid are produced, possibly within the ventricle, how they find themselves into the central canal and eventually into the meninges, so that eventually they are drained into the venous system. So this is what we'll just be exploring in this first session. So firstly, we have the meninges. We've said that these are tissues that normally covers the brain and the spinal cord. So if you look at the meninges, we have the three layers. So in the brain, this lie between the skull and the brain, between the vertebral foramina and the spinal cord. So the vertebral foramina, remember, it is that the bone canal that houses the spinal cord. So if you look at the meninges, we normally have the three layers: the dura, arachnoid, and the pia mater. So they are arranged from outward to inside. That is based on this classification. So on the outermost part, we have the dura. As you advance inside, we have the arachnoid and the pia mater. We'll also be able to appreciate some of the spaces between these layers. So starting with the dura, the dura consists of two layers. So we normally have an outer layer that normally takes the place of the periosteum. So this can be referred sometimes as let's talk of periosteal uh, dura. And we can have the other layer that covers the brain. So this is normally referred to as meningeal dura. So we are told that between these two layers of the dura, there's only a potential space. So a potential space means that these layers are greatly opposed in a manner that physically they'll seem as if there's no any space. So you don't expect anything between. Apart in some places where you'll be able to see now a real space that develops between the periosteum, between the meningeal dura, and between the periosteal. So we've said that the periosteal dura lines the skull of the brain, while this one lines the brain. So there's only a potential space between the two of these. So that means in some pathological condition, when there's a excessive accumulation of some fluid, possibly venous blood, as we'll be able to see, it can negotiate its way through this so that it destroys this integrity. So it is just a potential space, apart from in some area where it naturally opens up. So the exemptions include places like falx cerebelli. So this is where the inner layer sweeps inside the cerebral hemisphere to form the falx cerebelli. So just it should just be making sense when you're having the brain. If you look from it from the back, we are having two cerebral hemisphere, the right and the left. So while we are having the periosteal dura just in continuation with the skull, so this other one that normally lies within the brain, it can sweep over to this area, and as it's sweeping over, we are forming a space. So this space, if this is the space between the cerebral hemisphere, this will be regarded as the falx cerebelli. We'll be able to see the importance of this particular space. But for now, maybe we can preempt that these are the spaces where we can have the origin of the venous network system. Of course, from the brain, that is. So it means that this area must be somehow connected to the cerebral final fluid, CSF, that is. So apart from the falx cerebelli, they are also between cerebellar hemisphere to form falx cerebelli. So between the cerebellum, not the cerebellum, between the cerebrum, it also has two hemisphere. If you look at it posteriorly, so let's just assume this is the posterior. So there'll also be an invagination of the meningeal dura in this area, forming another venous space or another falx. So this one is normally regarded as falx cerebelli. And between the cerebrum and the cerebellum, there is the tentorium cerebelli. So maybe if we can go to the images, not sure whether clear adequately, but we can just have a look. So this representing the coronal, the coronal view or the frontal view of the brain in terms of cross section. So we are having the two cerebrum, or we acknowledge that we have the two layers of the dura. So let me access the two layers of the dura. So let's say this. So they are greatly opposed. So there's no space between them. So that is, they are all drawn by a blue line. So they seem as if it's just a single layer. But when it reaches in this great invagination of the brains, or great demarcation of the brain, that is between the left and the right cerebral hemisphere, the meningeal dura that is in close association to the brain rather sweeps into this area. So as it sweeps, of course, they'll be separating. So the separation gives us this venous space, or rather what you can refer to as the sinus. So again, we'll be able to experience the same sweeping when we'll be having the meningeal dura getting into the space between the cerebellum, that is, this is the cerebellum, and the cerebrum. So this will give us a space by the name tentorium cerebelli. Again, very important because it is a place that will sprout out a venous system. Same with the falx cerebelli. And only that it might not be clear from this. So if you try maybe to draw this picture laterally, so let's assume this is the cerebrum. So a little bit vague of ours, the bones and everything. And then now touch our cerebellum over here. So this is a lateral view. Of course, this is just one side. So you can just add another side. You can just add another side. So between this layer, we can presume this as right, and you add another left just on top of this. So there'll be this space. So this space, we can also have the meningeal dura sweeping into this particular space, again forming a falx cerebelli, as we've been able to say. So we are having the falx cerebelli, and the tentorium cerebelli. So these are very important in terms of the origin of the venous network of the brain. So if we can explore them a little bit, the same thing being emphasized over here. So from the falx cerebelli, we'll get a major sinus, or a major blood vessel from the sinus. So sinus, as the word suggests, it is like a space with a collection of fluid. So in this case, this fluid will be let's say a venous blood, because from the falx cerebelli, it houses the superior sagittal sinus. So where venous a blood vessel will originate. The straight sinus from the falx cerebelli, we've seen that this is the space between the two cerebellum. The transverse sinus originate from the tentorium cerebelli, the space between the cerebrum and the cerebellum. So if you can see with this image, the same thing being emphasized over here. So here we are having the superior sagittal sinus, inferior sagittal sinus. So these are very important vein. So we can see them, how they are sprouting from our expected sinuses. So for example, here we are having a straight sinus on this posterior area, giving out some important blood vessels. The great cerebral vein, we are able to see the superior cerebellar vein, the posterior median medullary veins. So there are a lot of veins that are sprouting from this venous space. So the straight sinus in the falx cerebelli, the transverse, not obviously seen in this image, but the sets the transverse from the tentorium cerebelli, and the falx cerebelli will be giving us the sagittal veins that can give rise to things like the anterior cerebral vein. So these are very important. So maybe back to our image, we said that we have the dura. So the same thing, I just want us just with more clarity. So we've said that the dura is in close association to the skull. So of course, the skull normally has the outer periosteum that covers its exterior. Inward, again, it should be having a periosteum, but in this place, we are having part of the dura forming now the periosteum. So you are getting the periosteal layer and the meningeal layer as a part of the dura. So these are just potential space, and as we move, they can open up so that the meningeal sweeps, because it seeks to cover the brain. So maybe what somebody should be able to note, in as much as the meningeal layer of the brain is advancing between these major demarcations, it won't be able to go through the minor fissures that you can normally expect in the brain. So ideally, the brain is majorly made of some form of, let's say, convolutions. and invaginations all the sulcus, that is, or in total sulci. So the convolution can term this as gyra, but we'll just be able to get through that. So let's just make it complete. Okay. And you can have a mirror image of the same. So you can extrapolate. So while you are having our, let's just, for a second, let's ignore the periostal layer of the dura. So let's just focus with the meningeal. So the meningeal will just be covering this part. So remember, if you can see from this image as we are drawing the meningeal, it is not advancing into the sulci. It is covering, it's just covering it over, not advancing. It only advances when there is a major a separation in the brain's area. So that's what we should be able to note. With the other layers, we'll be able to see, especially the peer layer. The peer layer will be able to advance with the sulci. So that is the dura mater. So we've seen it as having now the two layers. So after the dura mater, we have the arachnoid matter, because we said the meningeal has three layers. So the second layer is the arachnoid matter. This lies closely to the dura. So this is a layer of fibrous tissue that lies between the dura and the pia mater. It is separated from the dura by a subdural space. So there is a readily available space, a small space between the dura and the arachnoid matter. So the dura we are referring to is the meningeal dura. So let's just have our meningeal dura. So let's just thicken it a little bit. So not that it's thicker, but we just want to be distinctive. So this is the dura, the meningeal dura, and below it we are having the arachnoid matter. So we are being told that this is a fibrous tissue, a little bit moderately thickened. Okay, so in between this space, it is a subdural space, obviously. And remember, in the brain, we've not have the epidural space. This is because we do not expect a space between the dura and the skull. This is because the periosteal dura partakes in the or it lines normally the inner lining of the skull. So there's no actually epidural space in the brain. We'll be able to see that with the spinal cord, because this remember this meninges or meningeal layers normally spreads to the also to the spinal cord. So this is a subdural space, but that contain a small amount of serous fluid. And now at the subdural, just beneath it, you expect some pia mater. So let's just thin this layer so that we make just a clear distinction. So in between the arachnoid and arachnoid, so let's just give it as arachnoid. So the word arach should be enough. And this meningeal dura, dura should be enough. And this now becomes now the pia. So in between the arachnoid and the pia, there lies a space normally called the subarachnoid space. So it should make sense because it is below the arachnoid, or it is subarachnoid area. So subarachnoid space. So this is a very important space. This is because it contains the famous cerebral spinal fluid, or the CSF. So remember, in this place we are having the serous fluid, and in this area we are having the cerebro spinal fluid. So just put it here, CSF, save time. So the arachnoid matter passes over the convolution of the brain, accompanied by the inner layers of the dura, also assisting in the formation of the facts cerebelli and tentorium cerebelli. So if we could revert back to our prior image, we'll be able to see that the meningeal layer of the dura is normally greatly accompanied by the arachnoid matter. So maybe note that. Let me see if we have another image. So this is a perfect one. So we have this as our dura. So we are having this as our arachnoid. So we can see they are in close association. We are having here our subdural space. So as our meningeal layer of the dura sweeps over or sweeps into this particular space, it is normally accompanied by the arachnoid, as we are able to see over here. So that's why it will be obvious for us to say that the arachnoid matter also contributes in the formation of these sinuses, the falx cerebri, the falx cerebelli, and the tentorium cerebelli. This is because we are having this layer of the meningeal to accompany our meningeal dura. So this continues down the spinal cord and end by merging with the dura matter at the second sacral vertebrae. So maybe we can revert back to our image. We should also be able to see how the dura normally continues to give us to line rather our spinal cord. So let's just revert to the dura a little bit. So we are having the meningeal and the periosteal. So while this is our skull, so let's assume we are having our skull. Up to now, the outlet foramen area. So this we should be able to refer as the foramen magnum. So while we'll be having our meningeal dura advancing to the spinal cord, we should be expecting our periosteal dura to ends with the foramen magnum at this area of the scalp, so that we have our meningeal continues as it continues to house the spinal cord. So if you compare the vertebral that houses the spinal cord, so we propose the vertebral foramina, that canal that houses the spinal cord. We can just have a gross image of the same. So we are just having a normal periosteum lining this area of the bone, similar to this area, so that there exists a space between the dura and the bone. So this area is normally regarded as the epidural space. But if you can look at this keenly, as we are having our this particular space, so the main tissue of the spinal cord tend to end at around around first lumbar vertebrae. So that will mean that if you are to clinically access the epidural space, you'll prefer around from around second going downward. That is in attempt to try and drain, collect sample from this area, and not really collecting sample. In clinical, there's some form of drugs, an anesthetic drug that can be administered to the epidural space. So you'll rather administer at this particular area because there's a minimal chance of damaging the spinal cord. So even though we be having epidural space in this other area, but it is more appropriate to administer in this particular area. So that's how the dura continues with the spinal cord. And what we also expect these other layers to continue with the spinal cord. This is the arachnoid matter advancing almost around the sacrum, where now it joins to the periosteum of the coccyx. So eventually, also the dura will join with the periosteum. And here is the pia layer. It will join with the filum terminale. So let's just refer back to our text a little bit and see how it goes. So we've said that this is the arachnoid. So from covering the brain, it will continue down the spinal cord and ends by merging with the dura at the second vertebra. So this will eventually join with the dura, so that it doesn't seem as if there's an opening space from the inferior end of the spinal cord. So our third layer, innermost, is the pia mater. So this is a delicate layer of the connective tissue. We've been able to see that the two layers we've discussed so far are fibrous in nature. So the pia mater is more of a delicate tissue, connective tissue, that is, containing mainly minute blood vessels. It adheres to many brain completely and covers the convolution and deep into each fissure. So unlike what we saw with these other two, so this is likely now to advance. Let me see if we can get that image of ours. Not in this one, the one we drew, if you can access it. Not really accessible, so we'll just have a demonstration of the same. So we said that the brain normally has areas of convolution and areas of fissures. So brain normally can appear grossly like something like this. So while we've had the two layers of the meninges, just ignoring these fissures, it does not advance beyond these fissures. It just goes between major demarcations of the brain. But with the pia mater, it is in close association to the brain. So this will advance following these layers, following these fissures. So the gyra, the sulci, the gyri, the sulcus, the gyra, the sulcus. So this is how it lines the brain, and we've been told it houses some minute blood vessels. So either some form of veins or some form of arteries, of course, that should be supplying and also draining the brain. So very important. But this one specifically those that work mostly at the cortical area, as we'll be able to see. So this adheres to the brain completely and covers the convolution and deep into features. It continues downwards surrounding the spinal cord. Beyond the end of the cord, it continues as the filum terminale, piercing the arachnoid tube and goes on with the dura of the coccyx. So we were able to see that at around first lumbar, we were having the termination of the main parenchyma, or the main substance of the spinal cord, where now we are having, let's just demonstrate a little bit. This is the spinal cord from the superior part, and advancing into the inferior. So it will somehow, the main substance will end at the first vertebra, that is the lumbar. And then from there, we'll be having the two membranes, or rather the two covering of the pier, are uniting to give us the filum terminale. So this continues to pierce through the arachnoid tube. This is because we saw our arachnoid somehow advancing as something like this. So it pierces this tube so that it now joins the arachnoid and the pier that already join to form the periosteum. So this will be in continuation with the periosteum of the coccyx. We don't expect a great major canal, unlike the vertebral, unlike the lumbar and the thoracic vertebral. So this how these layers are very important, and this how these layers are normally are in close association to the others. So maybe if we can revert a little bit to our image over here, we be able again to explore the sinus and see how they are related to these other layers. So we suggested that we are having our periosteal dura lining the skull. So this is the skull, or rather, yes, the bone, and we are having the meningeal forming a space. So this space normally called the dural venous sinus. And what you can see, this area is again connected with some form of vein we can call the emissary vein. So the emissary vein seeks to connect the veins that are found in the scalp to those in the venous sinus. And we'll be able to see, we suggested that the arachnoid space or the subarachnoid space normally contains the CSF, and the CSF is normally eventually drained into these sinuses, so that we have this complete circuit. So somebody can say the blood needs to get some oxygen and every nutrient that comes from the blood. So there'll be arterial system into the brain. So arterial system, we of course, for it to reach the brain, it will eventually be transformed into capillary network. So as it will ordinarily apply. So the capillary, we're having nutrients, substance shifting now into the brain. So what we anticipate is as it's seeping into the brain, there is some form of the capillary network or some blood network. We'll be able to see them as choroid plexus. So this is the point where now a blood, we can say, being transformed into the CSF. So remember, one of our neuroglial cells, the ependymal cells that lines the choroid plexus. So we are able to get our CSF. This occurs in the ventricles that we are just about to examine. So the ventricles, from the lateral, third, fourth ventricle, there's the formation of the cerebral spinal fluid. Of course, from there, this is in continuation with the central canal of the spinal cord. So from the spinal cord, there are very many we can say foramens that seeks to communicate the central canal to the subarachnoid spaces of the spinal cord. So we'll be able to see this foramen. I think it's foramen of Magendie. And at the fourth ventricle, we can have a communication with the roof of the fourth ventricle to the subarachnoid space. So that means that this fluid will eventually reach the subarachnoid area. subarachnoid, let's use the word space, where you'll be able to see the subarachnoid space are in close association with the dural's venous. So where they'll be able to communicate, they normally communicate with the venous by sprouting out. You won't say a vein-like, but you'll say something like a villi-like. So let's just draw something over here. So this is our subarachnoid space. How are they related to this space? So they'll be sprouting out what we call villi. So villi, this allows this CSF fluid to be drained into the sinus, so that it collects to become now the blood. So this is how it communicates. So if you are to complete the circulation of the cardiovascular system and the CSF, this is the flow that is likely to follow. So that eventually into the subarachnoid space communicates into the dura by use of the arachnoid villi. So we'll be able to see that this is somehow valve-like. There's some form of pressure that will be affecting how this place is either closing, but not really closing, affecting how it's collapsing, and maybe sprouting out so that it can comfortably give out fluid. So we can go straight to our now the ventricles, having that maybe now we've covered the meninges. So what are ventricles? So these are spaces or somehow cavities within the brain parenchyma. So they are very important for the sole purpose of cerebral spinal fluid production. And as we'll be able to see that the cerebral spinal fluid is actually very important in the brain because it serves various roles in the brain. So the brain consists of irregular shaped cavities or ventricles containing the cerebrospinal fluid. So these are the ventricles. So we are having the right and the left lateral ventricle. So we'll be able to see that anatomically. So these are housed in the, this should be housed in the cerebral hemisphere, the right on the right cerebral hemisphere, the left on the left cerebral hemisphere. And they are normally communicated. There is normally some form of communication with some thin membrane. I'm not sure whether it will allow the fluid to flow from the right to left, but there's a thin membrane by the name septum lucidum. We'll be able to see that. So from the right and the left, it is normally into continuation with the third ventricle, and the third ventricle into the fourth ventricle, and the fourth ventricle eventually into the central canal. So this is the image that we are proposing, where we are having the two ventricles, the true ventricle housed in the one of the cerebral hemisphere, where they are joined together by a thin membrane. Let's just write over here, septum lucidum. So septum lucidum, this is a thin epithelium. So I'm not expecting some form of fluid or CSF communication between these two lateral ventricles. So they communicate with the third ventricle by use of intraventricular foramina. So we should be having the intraventricular foramina. So maybe if somebody was to look at, let's assume this is the right, this is the left. So there should be a communication like this, so that we get our third ventricle. So this is what I'll refer to as the interventricular, of course, foramina. So foramina representing a foramen. So the third ventricle Of course, if you can see anatomically, so this is situated below. It is situated below the lateral ventricles, between the two parts of the thalamus. So we are having the thalamus having only that this is a medial view. We are not, or medial or lateral view. You are not able to have. We are not able to see the thalamus because obviously our image is blocking it. It communicates with the fourth ventricle by use of cerebral aqueduct. So we are having the cerebral aqueduct, a communication between the third and the fourth ventricle. And as you'll be able to see, the fourth ventricle is in continuation. So here is a fair demonstration. Continuation with the central canal that begins at the foramen magnum of the brain, not of the brain, but rather of the bone. And as it continues with the spinal cord into now the central canal. So the spinal cord has the CSF inside it, the central canal, and of course there'll be some lateral communication by the foramen magendi into the meninges that we've been able to propose. So these areas of the ventricles are very important. The reason why they are important, they have the choroid plexus. So the choroid plexus signifying maybe the end of the capillary network that allows for the exchange of blood. But rather than getting the blood into now this ventricle, we because of the filtration process that is expected, will be resulting with a fluid that will be now referred to as the cerebral spinal fluid. So I think this is what we've said. We having the lateral, we having the third ventricle, and of course the fourth ventricle. So maybe what we should know that the fourth ventricle, yes, is a diamond in shape, just between the cerebellum and the pons that we've been able to see. So the pons is a little bit is just here, just below the midbrain. So between the pons and the cerebellum lies the fourth ventricle, a diamond in shape, where the sharp area is oriented anteriorly. Another thing to note is that at the roof of the fourth ventricle, it can leak this fluid or the CSF into the arachnoid space. So how does the CSF fluid get into the arachnoid space? One of the ways is by the direct communication between the fourth ventricle and the arachnoid space by using the foramina that's available at the roof of the fourth ventricle. While the CSF that enters the central canal of the spinal cord will eventually communicate with the subarachnoid spaces of the spinal cord by use of the foramen of Magendis. So now onto the cerebral spinal fluid. Having that, we've now laid out the anatomical area of this fluid formation. So we've said that this is normally secreted by the choroid plexus. So the choroid plexus, these are vascular areas where there's a proliferation of blood vessels surrounded by the ependymal cells in the lining of the ventricles. So the CSF, so that is what we anticipate. And eventually we'll be able to have our CSF, and the CSF, we should be able to get itself back into the bloodstream by use of the arachnoid villi. So the arachnoid villi, we were able to demonstrate as some protrusion of the subarachnoid space into the venous sinus. So remember the cerebellum and the cerebri fluxus and the tentorium that we are able to mention. So which projects into venous sinuses. So the whole network of the cerebral spinal fluid representing the point of production up to their point of absorption to the arachnoid villi. So let's just revisit microanatomically what you ordinarily anticipate. So let's maybe our focus not on these major areas. So our focus, let's our focus be within this particular area. So when we talk of choroid plexus, this is exactly what we mean. So we are able to see our network of blood vessels, where at the end you're expecting some form of capillary. So capillary giving us the blood vessel, or not the blood vessel, that is having some blood, and the wall of the capillaries readily allow for substance to, or rather fluid to leak, so that you are able to get some waste, and we are able to give some nutrients and oxygen as we will ordinarily anticipate with the other tissue. So let's just make the direction be like this. So we are able to see an exchange over here. So where the blood vessel is able to get some waste and also some other substance from the CSF in exchange for with some other substance such as nutrients, oxygen, some very much needed ions such as sodium, potassium, chloride, bicarbonate, calcium, magnesium, and vitamins, many things that are required to the CSF. So this is the point of exchange. And I think this is the right spot to acknowledge that while you are talking about the lymphatic system, the brain does not have an ordinary lymphatic system, but in place of lymphatic system, we can have the CSF system playing the role of the lymphatic system. Normally, sometimes referred to as the glymphatic system. Why is it so? We say that the lymphatic system normally offers an alternative drainage of the fluid. And what is the CSF doing in this particular area? You can see that there is some fluid that are, you can assume that this is an extracellular space. So there are some fluid that are being deposited here from the capillary, and eventually there's some form of exchange. So while there'll be some fluid that will flow back through the venal end of the capillary, so that it continues into the blood stream or into the blood circulation, there are some that will not be able to come into the blood vessel. As a result of that, these ventricles or the CSF space will be an alternative in terms of draining these other fluids, using which way the alternative CSF circulation that we've been able to demonstrate from the point of choroid plexus, as we are seeing, up to the point of arachnoid villi in one or in some of the dural sinuses that we should be able to see. So that is good to note. So this what happens. We will be having our CSF formed at this particular spot. So this is the end. This is even a perfect image. So this is a dural sinus, so not label, a dural sinus, and this is the arachnoid villi, and this is now the falx cerebri. So the point is just to get, eventually after we've had our CSF in the subarachnoid space, how will they disappear? So they'll be mostly drained into this particular spot, so that at least you can have a balance between the formation and drainage. This is very important. If you're having an issue with overformation, you think of things like increased intracranial pressure. You're having an issue with the drainage where the drainage is not as adequate. Again, you're having an issue with an increased intracranial pressure. So these are some of the various important points in attempt to investigate, or rather trying to form hypothesis revolving the possible diagnosis of a particular individual with these scenarios. Maybe an infectious process, occluding this, a malignant process in these particular areas, as we'll be able maybe to see later in the neuropathology. So in continuation with our text, of course, from the ventricle through the roof of the fourth ventricle, the CSF fluid will be able to get into the subarachnoid spaces and eventually into the venous. And we've been able to see the central canal fluid flowing from there using the foramen of Magendis into the subarachnoid spaces in the spinal cord, and the flow will be having a superior flow. So anytime with the CSF, so the flow is normally oriented on this spot superiorly up to the point of drainage. So the same we should be having a mirror image of the same on this other side. So when the CSF pressure is higher than the arachnoid villi, this collapse preventing the passage of blood into the CSF. So a little bit of into that image to appreciate that mechanics. So this means that this is a very flexible area. So let's assume having some space or some pause. So if the pressure is high at this particular point, it will be able to exert pressure on this protrusion so that it collapses. So once it collapses, it will prevent the movement of blood back into the cerebral spinal fluid. So that's how it operates. When the pressure of the dural sinus venous is low, it will mean that this will bulge out as normal as it should, so that it allows fluid to drain. So there's that point of balancing. So assuming you are having a condition that maybe is causing the dural sinus venous to increase in amount, so that will mean that our arachnoid villi will collapse and we'll be having accumulation of fluid in the arachnoid space. So we'll be having somehow an increased intracranial pressure as a result of the CSF. In pathology, you'll be able to explore what are some of the circumstances. Could there be a blockage in terms of the outlets that you'll expect from these veins over here? So many things that we should be able to explore. So it is operating somehow like a valve-like. And maybe something good to know, in the flow of our cerebral spinal fluid, so there's no an intrinsic pump like in the blood vessel, where you can have the arteries and also veins relaxing, contracting in attempt to pump to pump the blood. So in this one, there's no that intrinsic mechanism. It is actually dependent on some other physical pressures. That is the position of a person, how somebody inspirate and expirate, and how maybe the blood vessel are pulsating. All this movement will contribute to the movement of our CSF. So it is good to note that this is normally secreted continuously, as the rate of absorption also takes place continuously. And per minute, the body, or rather the choroid plexus, is likely to produce around 720 mLs of the CSF. So the CSF, what is it? This is a clear and a slight alkaline fluid with a specific gravity of around 1.005, consisting of water, mineral salt, glucose, plasma protein, and also a small amount of albumin and globulin. A few leukocytes also contain some creatinine and urea. See, these are some of the waste products that you'll ordinarily anticipate. So maybe I might want us to read in details some of the function that you can expect with the CSF, but maybe I'll just give us a brief of what we anticipate with the CSF. So one of the most important function of the CSF is the buoyancy role. So this proposes that the actual mass of the human brain is around 1,400 grams to around 1,500 grams. But when this is suspended in the CSF, the weight normally reduces to around 25 to 50 grams. So that is now the role of the buoyancy. So it is somehow able to reduce that weight because our fluid, or rather the CSF, is giving us that buoyancy characteristic. Another reason why CSF is important is obviously for protection reasons. It normally protects the brain tissue from injury when jolted or when hit by providing a fluid buffer that normally acts as a shock absorber from some form of mechanical injury. Very important. It is important in the prevention of brain ischemia. This is aided by decreasing the amount of CSF in the limited space inside the skull. This decreases the total intracranial pressure and facilitate blood perfusion, because this fluid need to be drained adequately. So this is not a direct function, it's somewhat indirect, because you can just imagine what will happen when we are having accumulation of the CSF. It will actually exert pressure, and when the pressure is exerted within the brain parenchyma, that might also mean that the blood vessel or the blood network will also be compressed. So the brain can actually be denied some form of blood supply that possibly will shrink the amount of oxygen that the brain should be receiving. So the CSF is also very important in regulating the breathing. This is just by a simple explanation that the CSF normally bats the respiratory centers of the brain, or the respiratory chemoreceptors, where they are located in the medulla oblongata. Of course, it is very important in clearing the waste. We've been able to propose that this is an alternative lymphatic system. Some of the organs that do not have a normal lymphatic system is brain, but alternatively, it employs the CSF to partake that role, where it can be referred to as the brain's lymphatic system, or rather the lymphatic system. So we've been able to see offering an alternative way for the drainage of fluid. So once some of the fluid have seeped out of the capillary, specifically at the choroid plexus, some of course not able to find them their way back into the venual capillary. So some will be confined within the ventricle and will follow the ventricle flow, central canal, and eventually into the subarachnoid space. So we can pause it at this particular time. So in our next episode, we'll be dealing with the brain. And remember, we'll just be exploring just the, for now, we are just exploring the gross anatomy, or the gross physiology that we anticipate with this system as large. That is before we get back to our cellular neuronal physiology. So let's have a break, and then we'll continue with the brain in our next session.